I'm Janelle Newman from the University of Miami's Health and Elder Law Clinic, and for the last 6 years it's been our privilege to represent many of Dr. Kolber's patients and to work with the community here. This spring we had clients who lost their meds during the funding crisis for a couple of months, and they really disengaged from care, and we could see that it was very palpable. I am here to comment, however. I understand the need to try to avoid things like that happening, but I am here to comment on the potential changes to the federal poverty guidelines that may govern future decisions. And I would also urge you to be more forthcoming and transparent with respect to what you're thinking about and where the justifications are. In 2008, the agency took the laudable step of increasing eligibility criteria from 300% to 400% of the federal poverty guidelines. There have been no changed facts since that time. Florida is currently at 400%, in line with similar states with similar populations, such as California, and in fact in Washington, D.C., which is very close to our population, there's a 500% federal poverty limit. I've carefully reviewed the HHS compliance review, and it doesn't direct for or call for this kind of change. It does recommend a number of other cost-saving considerations and measures, similar to what the AIDS Healthcare Foundation discussed earlier, such as looking at the local drug assistance payment standards, etc., and the development of a formal written cost containment crisis management plan. We think these things should be done first before looking at eligibility of real patients who are receiving life-saving treatment. And with respect to the 400% of federal poverty, more than 22% of Florida residents between 250 and 400% of the federal poverty limit have no access to insurance of any kind whatsoever. That is higher than the national average by 7%. And insurance at that economic level is almost certainly inadequate to cover the expenses needed. Immigrants, and this is a large immigrant population that we have here, are the most vulnerable of all. In 2001, pursuant to an Attorney General order, immigrants are eligible for Ryan White care who are not eligible for Medicaid, Medicare, and other federal insurance benefits. The Ryan White program is their only lifeline. They will not be eligible under the health care reform either. And so we urge you to give serious consideration to these issues. Thank you.